وبعدين؟
ايوه تمام، الحين تمام. دكتور استمع.
Bismillah ar-Rahman ar-Rahim. It is a great pleasure to welcome all of you to the third and last day of the first annual Web Symposium of Dental Services in Second Health Cluster in Central Region that is held in cooperation with the Deanship of E-Learning and Distant Learning in Imam Abdurrahman bin Faisal University. It gives me honor and privilege to be a member of the scientific committee of the symposium and your moderator for today. My name is Dr. Ahoud El-Harthi. I'm a consultant in restorative dentistry and the director of the Academic and Training Affairs in East Riyadh Dental Center, one of the components of the Second Health Cluster in Central Region. I would like to remind you to scan the QR code. It's going to show up in front of you to confirm your attendance today. Today's program schedule, as shown on the screen, is chosen to be the grand finale of the symposium because the variety of topics concerns different health specialties, dentists, hygienists, as well as infection preventionists and health informatics specialists. Now it's time to introduce the first speaker for today, Dr. Hissa Mohammed El-Waili. Dr. Hissa Mohammed El-Waili is a consultant in oral diagnosis, oral medicine from the Ministry of Health, Riyadh, Kingdom of Saudi Arabia. She received her bachelor degree in dental surgery from King Saud University, College of Dentistry. She obtained her master's degree in dentistry and clinical certificate in diagnostic oral sciences in 1998 from the Dental College in the same university. She obtained an international certified training program in aesthetic dermatology diploma from Toronto International University, Toronto, Canada in 2015. Aside from giving lectures in various universities, Dr. El-Waili had also presented lectures and workshops in application of Botox, fillers, and other related topics in oral medicine locally and internationally. She also published more than 14 articles on the same topics. It is a great honor to welcome you, Dr. Hissa. So if you are ready now, I'm sure we are all excited to hear you speak.
Alaikum wa rahmatullahi wa barakatuh. Thank you, Dr. Ahoud, for the introduction. Thank you to the organizing committee of the first annual Web Symposium in the second cluster for inviting me to give this talk about the Botox and filler. Well, talking about Botox and filler, for me, it's an interesting topic. Although botulinum toxin is known many years ago, it has been known since 20 years ago, botulinum toxin discovered, but every time and all the time they talk about it as if it is a very new topic. I'll make it short today, and I'll try to give you an overall idea about the botulinum toxin Botox and about hyaluronic acid filler. Actually, I'll talk about the therapeutic and cosmetic application of Botox and hyaluronic acid, well, in general, and maybe little bit more in the dentistry. And in the same time, I will mention some of the cosmetic application of Botox and filler. During my lecture, I will mention some of the clinical cases. In the same time, I'll put two of my research. I hope you will enjoy my lecture. I'll try to make it brief. To make an outline for the lecture and just to organize the audience, I'll talk about the history of Botox, botulinum toxin. I'll talk about the indication, contraindication, advantage, disadvantage. I'll mention some cautionary statement. I'll mention about the informed consent, the importance of informed consent. Well, in more detail, I'll explain the management of pain, bruxism, and gummy smile in our field as a dentist. Well, during the presentation, as I mentioned, I will put some of my clinical cases. What is Botox? This slide shows you briefly what is Botox and the history of Botox. From this slide, you can know that the Botox was discovered in 1820s, يعني 200 سنة من الآن. When Dr. Justin was investigating the cause of the death of the German man who consumed a sausage. Then they found out it was food, he eat food born with botulinum toxin. Later on in 1940s, United States attempted to use botulinum toxin against its enemy in the Second World War, الحرب العالمية الثانية. Well, researchers took this botulinum toxin, they purified, they make it purified, they make it in crystalline form, and they kept it for future medicine. Well, from the brief history I gave you, you can guess that Botox is one of the most naturally occurring poison. It's a biological poison. And from the brief history, you can tell that it is the cause of many accidental deaths in the past. Later on, researchers discovered that injecting an hyperactive muscle with a small amount of botulinum toxin will cause relaxation of that muscles. Relaxation of that muscles will be temporary for 3 to 4 months, maximum of 5 months maybe. Well, how it works? As you know, that the acetylcholine, it's a neurotransmitter which causes muscles to contract. In the same time, it causes the body to secrete, or secretion of the body to come out. So botulinum toxin, the protein, it go and block that place where the acetylcholine released, so no more acetylcholine, no more movement, and no more secretion from the body. This is very simple description of the action of the Botox. The first, it's mentioned in the literature that the first medical use of Botox was in 1979 when an ophthalmologist, Scott, he used it to treat strabismus, الحول. He used it to treat strabismus, الحول, by injecting it into the external eye muscles. In 1989, botulinum toxin was approved by US Food and Drug Administration. Of course, when it's approved by Food and Drug Administration to be used for cosmetic and medical procedure, the use of Botox expanded. And if you remember, we knew recently only about Botox. It's يعني 1992 94 we heard about it, but the application of Botox here, it is very يعني considered يعني 20 years maximum of 1990. It's not too much. Okay, then most of the people know about there is misconception about the indication of botulinum toxin or Botox. Here, I will mention some of the indication of Botox. Actually, for Botox, there are some general indications and some dental, let's say dental indications. Well, I'll mention first the general indication very briefly, then I'll go in detail, in more detail, in the more dental indications. What are the general indications? Strabismus, blepharospasm, hemifacial spasm, hyperfunctional larynx, allergic rhinitis, juvenile cerebral palsy, cervical dystonia, spasticities, writer's cramp, occupational dystonia, pain and headache, hyperhidrosis, and cosmetic treatment of hyperfunctional facial line, which come here in the last one. And if you notice, most of the people know only about the cosmetic treatment. They don't know about all the medical treatment of the Botox. What is that strabismus? As I mentioned earlier, it's الحول. By injecting it into, by ophthalmologist, of course, they inject it into the external eye muscle to correct the strabismus, and actually it's effective. And now all the ophthalmologists, they use it. Okay, the second application is juvenile cerebral palsy. Juvenile cerebral palsy, as I put this illustration to make it very simple for you. It's actually a term given to a group of disease which affect the posture and the movement of the muscles. And this type of defect or disease, it's non-progressive and permanent condition. What does it mean, non-progressive and permanent condition? It means that a child will be born with it. يعني الطفل يولد به. Their parents, while he's infant, their parents won't notice that he has juvenile cerebral palsy because no movement. When he grow up, they will notice that the child is not moving his hand or leg or part of his body. Well, a lot of published paper recently talk about the effect, the good effect of botulinum toxin in the treatment of juvenile cerebral palsy, either monoplegia, which is one part or one arm, hemiplegia, diplegia, or quadriplegia, as you see in this illustration. The second indication is blepharospasm. What is blepharospasm? Blepharospasm, actually, it is involuntary movement of the muscles around the eye. Well, it results in uncontrolled blinking of the eyes and maybe closing the eyes. Well, it's difficult to understand the blepharospasm and what is the cause of it and what is the cause of the damage to that nerve to cause this contraction of the muscles around the eye or orbicularis oculi muscles. So Botox, and I will show you one of my cases, will be very effective in that area. Okay, the other indication is hemifacial spasm. Hemifacial spasm usually unilateral, and its effect, when I say unilateral, you can guess على طول, it affects the facial nerve, any right or left facial nerve. There is a typical hemifacial spasm and atypical hemifacial spasm. A typical hemifacial spasm starts from orbicularis oculi muscle, from the lower eyelid, and proceed from the cheekbone to the lips. The atypical one, oh no, it starts from down, from orbicularis oris muscle, and up to the upper to the lower eyelid. Well, in both cases, Botox gives a very good result for this condition. The other condition can be managed by Botox is spasticity. Spasticity simply is tightness and stiffness of the muscles. Usually tightness and stiffness of the muscles due to damage of any portion of the brain who's responsible to control the movement, to control that movement. Subhanallah, أحسن الخالقين. كل شيء في الجسم, it has certain area and the brain to control. Any damage to that the portion of the brain which cause the control of the movement. It can cause spasticity in the hands. Well, very effective. Literature said it's very effective Botox for treatment of such a disorder. Another condition, gustatory sweating. What is gustatory sweating? Gustatory sweating is sweating during eating. يعني الواحد إذا شاف الأكل يقوم يصير يتعرق، يصير يصب عرق. Well, sometimes we see some people when they eat spicy food or hot food, they have some sweating. Okay, it's okay. But some of the people have excessive sweating in certain area of their faces when they remember the by injecting the area of sweating, either, well, usually it's parotid area, submandibular, here it's in the submandibular area. So can be injected here to, can be injected to improve the condition. Also, this gustatory sweating, they said it's one of the complication of diabetes mellitus. Another condition to be managed by Botox injection is sialorrhea. Sialorrhea is the excessive salivation, as you see here. It's excessive salivation. طبعا, of course, dry mouth is undesirable, but excessive salivation also it's undesirable, especially in the patient, handicapped patient, patient with cerebral palsy, patient with Parkinson's disease. They have excessive salivation. Injecting Botox in the parotid or submandibular or sublingual salivary gland will reduce this hypersalivation or excessive salivation, but the injector should be very, very careful not to cause dry mouth to the patient. يعني, well, when you know it, you have to do it. If you don't know it, please don't do it. Okay, and another application is masseteric hypertrophy. As you know, some of the people, they have squared face or hypertrophy masseter muscles on both sides. Well, it can be unilateral on one side. Well, beauty, when they make survey, they think that the oval face and diamond or heart-shaped face and the diamond-shaped face are the most beautiful faces for the female, and the square face is good for male. So, well, if the patient or the person does not like his square face, okay, injecting Botox in the masseter muscle, which is hypertrophy, can reduce and give more tapered face. Well, previously it was managed, the hypertrophy of masseter, it was managed by surgery, by removing part of the masseter muscle under general anesthesia. And you know, general anesthesia, surgery, side effect of the general anesthesia, and complication of the surgery, scar formation, all these side effects. But now with very simple procedure, you can treat the hypertrophy masseter muscle with the injection of Botox, and that was introduced in 1994. 1994, and relatively recent, and it was introduced by Smith and Moore. Well, injecting the hypertrophied masseter muscle will result in more tapered, nice face. Well, here, when you, the injector should be careful not to inject the parotid, because it's the area of the parotid. The patient will end by having xerostomia. Okay, this is more tapered and beautiful face. Another application is cervical dystonia. Cervical dystonia, well, as you see from this illustration, you can see it is the spasm, tightening, and the head is forced to certain direction. and the person or the patient cannot move his head due to spasm in that muscle, due to tightness and spasm in this muscle. And I think in dentist will have some of this condition because of their way of working on the patient. The cervical dystonia could be laterocollis, thoracollis, anterocollis, or retrocollis. Cervical dystonia can be improved 80% with injection of Botox. That area with dystonia, sternocleidomastoid or trapezius muscle, can be relaxed by injecting Botox. The another application is writer's cramp. Writer's cramp. Okay, it's considered dystonia. It's similar to cervical dystonia, writer's cramp. Usually it affects people who write too much or playing a musical instrument. They have dystonia and difficulty and stiffness of certain area in their arm, in their fingers, can be improved with injection of Botox. Hyperhidrosis, classical hyperhidrosis, as you see here, classical hyperhidrosis, التعرق من from face, under arm, hands or feet is normal. طبيعي إن الإنسان يتعرق، يعني ما في، يعني كل الناس يتعرقون، الإنسان يتعرق بدرجة معينة من العرق, it's okay, no problem. But some of the people they have excessive, that embarrass them, يفشلهم قدام الناس، يتعرق مرة، يتعرق كثير. Well, can be managed. It's very easily managed with Botox injections, especially if it is in the face and underarm. Easy and non-painful. Easy and non-painful. Well, managing hyperhidrosis in the palm and plantar in the hands and feet, it's very effective. Little bit painful because the area there is hard to inject. We're using insulin syringe, but it is يعني شوي painful. Allergic rhinitis. Allergic rhinitis documented that improved by Botox injection in the inferior turbinate of the nose, and there is a published paper about it. Here we say allergic rhinitis, allergic non-pathological rhinitis. Yeah, rhinitis without any pathological cause can be improved by injecting Botox. Oromandibular dystonia. Oromandibular dystonia, well, from the name, it is عدم تناغم العضلات في الوجه والفكين. عدم تناغم يعني حركة عضلة تتحرك في جهة والثاني في جهة واحدة، فيكون عدم تناغم هذه الحركات. Can be managed when you know the anatomy, when you know where to inject and which of these muscles affecting the spasm and contracting abnormally, and you inject that muscle. Yes, you can improve it. And when you think of doing something like that, you have to know all of these muscles by name. All of these muscles, well, I no need to mention them, but these are about 14 muscles in the oromandibular causing oromandibular dystonia. Trigeminal neuralgia, yes, trigeminal neuralgia can be managed by Botox injection, either affecting trigeminal neuralgia, affecting the ophthalmic branch of the trigeminal nerve, affecting maxillary branch of the trigeminal nerve, or the mandibular branch. You can go along the nerve if you know the anatomy, go and inject Botox with certain amount, and it will be improved. It's documented and it's approved by FDA, approved it to be effective. Another indication is pain and headache. Pain and headache, now it's if the patient is suffering from headache more than 10 days in a month ولا 14 days in a month، يعني طول الأيام يقعد ياخذ analgesic with the all side effect of analgesic, he should go for Botox injection, and it's approved by FDA to be that the Botox can manage pain and headache. My experience in that part, that tension headache, 100% improvement, 100% improvement of tension headache by injecting Botox, especially when it starts in the occipitofrontalis muscles. Sinus headache also it improve. And then cluster and migraine headache, maybe 60 to 50% improvement. Who's interested? A lot of papers published about this topic. Then we come to the last general indication of the Botox, which is smooth out the bust. Smooth out the bust, and the people know only about this indication. Most of the people, only this indication they know about it, and remove the wrinkles, remove the aging signs on the face. Why the patient seeks removing or erasing the wrinkles? Because the hyperfunctional facial lines or facial expression, the facial expression make the person misinterpreted. People will misinterpret you. تجي من بيتك متضايقة من شغلة ما لها شغل في الدوام يقولون وش فيك زعلانة؟ وش فيك متضايقة علينا؟ So what is inside will appear to all of the people. So when you inject Botox, the right way to inject Botox is to relax the facial expression, to relax the facial expression and not to make it a mask face. يعني some clinician or practitioner, when the person had a Botox or she has a Botox, you will see her face as a mask face. It's wrong. It's wrong way of treating. You should relax the muscle and not paralyze it, not make paralysis that the patient will look a mask face. No, just relax the muscle so the facial expression will be less. Well, before introduction of Botox as a cosmetic part, a lot of facial plastic surgery done. And this is reported that a lot of facial plastic surgery done in the past, but now after introduction of the Botox, it's less, it's more less. And the Botox gained a wide spread. And all the people start taking Botox, who's interested to have Botox instead of making plastic surgery to improve their aesthetic. And if you see من 2011 ل 2013 how much increase in the use of Botox, and now أكيد it's more and more, and the ages between 35 and 50, the ages who ask for Botox. So يعني اللي حسوا إنه بدأ العمر يبان عليهم كذا just they run to have Botox to erase some of our smoothen their wrinkles. And as you see here, one of the celebrities, this in 2000 and 2008, 8 years difference, and she looks كأنه هذه الأم وهذه البنت. So it makes a difference. Actually, it makes a difference. I will show you some of the this is Brigitte Bardot, an Italian actress. ما لحقت برجيت باردو ما لحقت على البوتوكس والفيلر، فهي هنا في العشرينات وهنا 63 عمرها أو 65 سنة، فهذه ما يعني ما عملت بوتوكس، فالaging process it affect يعني the person too much. Well, this is another person with 92 2011, and you can see the difference as he's get younger and not older. Okay, celebrities having Botox to make any brighter face, more relaxed. Okay, what are the common area to inject for Botox? Usually the 3 areas. يعني والfacial expression أكثر شيء يكون في الفرونتاليز في الجبهة وحول العيون وفي الإلفن رقم 11 اللي بين العيون. سو الجلابيلا بري أوربيتال كراوس فيت رجلين البطة اللي على جنب العين والفورهيد. I'll show you briefly some of the cases. As you see this patient, he's 30 years old. This is pre and post. Here before injecting Botox, and see how much 30 years for this, and this is after. His crow's feet, as you see, his more crow's feet, it's very smooth. Another patient before and after. Botox injection for the smoothing the wrinkles around the mouth is very effective, especially smokers. Well, it smoothens the area. Smoker lines. This patient, she has smoker lines. This is after the Botox. If we inject very more, there will be, she cannot control her orbicularis oris muscle. This is the brachii anguli oris muscle here, and this is about 70 years old female. She was worried about this groove and pulling down of her marionette line. So little Botox with little filler gave her this appearance. Well, mentioning the application, I mentioned very briefly, but still the Botox is still a new topic to talk about. There is a lot of off-label Botox treatment, that the practitioner will find that he can do this, he can do that for the patient, depending on the complaint of the patient and knowledge of the practitioner about the anatomy, about the material. So it's very important to know about the anatomy, about the Botox, to work for it. Okay, less off-label, like decreasing the size of the nose. We injected, see the nose before and after. Yes, effective, 100% effective. If the patient is satisfied with decrease in her nose by 3 to 4 millimeter, yes, it can. Especially, I want to say this point, especially if it is muscular. Yani if the nose bony, no, the Botox will not work. Botox works on the muscles, only on the muscle. If the nose is, as you know, as we get older, our nose get larger and the ears get larger. So if you want to reduce, to go back 10 years with your nose smaller, okay, you can inject it with the Botox. Treatment of palsy, if the patient has a unilateral smile, asymmetrical smile, yes, we can improve it by injecting Botox. As you see here, this patient, she has asymmetrical smile. I injected her with a little of Botox. She's very happy. Okay, this is another, this patient, blepharospasm. I injected her with Botox to treat her blepharospasm. This is, as you see here. This is the affected side. This is the affected side, but she closed this side also. I don't know, it has been many years, and she visited a lot of doctors without improvement, and she came to me. So, as you see here, so we treated this patient. I will, this is the post. I don't know why it come. Okay, you'll see now. The same patient, doctors. It's the same patient. So if you know how to apply it, Botox is very effective. You just have to know the anatomy and the material very well, very well. Another case with dystonia, or see the dimpling here in her chin, as you see here, spasm, and here the contraction of the muscles on both sides. I don't know, very difficult case. See this case, this is pre-Botox injection. This is a pre-Botox injection. Okay. This is the same patient post Botox injection. Patient is very, very happy. Her daughters, her family, all very happy with the result, actually. Alhamdulillah. Big difference. More relaxed face. The muscles around the mouth is very relaxed. She talk with confidence, like not like the previous slide. This is another patient, one of my patients. Okay, so as you see here, asymmetry and the smile. Well, she had Bell's palsy and dimpling here in her chin. And this is after the treatment. See how much this gone totally. Her smile is normal. Off-label use of Botox also in the treatment of neck bands, as you see, neck bands. Neck bands caused by platysma muscle. Platysma muscle is a very big, as you see here, very big superficial muscle extending from below the clavicle to the maybe to the corner of the mouth and to the lower border of the mandible, and it causes the bands. And when we inject it with the Botox, it gives a very nice smooth result. Well, you have to be careful, and I'm very, alhamdulillah, I'm very careful when I inject, because if it go to the airway, the patient will have difficulty in breathing. So when you work with Botox, you have to be cautious. You have to be very, very careful. Another, see the bands, and here is the bands, and after the injection. This is one off-label treatment. Actually, this treatment, I did not read about it in the books, and I, alhamdulillah, shukrullah, I did it for my patient, and very happy patient. As you notice, some of the patients, they have a very narrow medial canthus of the eye, which is tilted downward, narrow and tilted downward. If you inject the Botox in certain area, I will not tell where because it's my special thing. Well, it will widen the canthus, the medial canthus, and put it up. Okay, so and see, this is the patient. See the canthus, how narrow and tilted down, how wide and beautiful. The same, see this eye, so the canthus tilted downwards. Then, okay. I mentioned now mostly the general indications approved by FDA, Food and Drug Administration American, and some off-label indication, which is known between the dermatologist and this, and off-label and some of the label indication. Well, now I will mention the list of the botulinum toxin in dentistry. And before I put my slide, please just put in mind what you think. How many indications? Just put in your mind what you think. Okay, here we go. Temporomandibular disorder, pain and bruxism, masseteric hyperatrophy, hemifacial spasm, myofascial pain, gummy smile, trismus, Sayalurhia, retraining muscle during orthodontic treatment in patients with very strong muscles. Well, when an orthodontist put the brackets for the patient and the patient muscle very strong, then he will press the muscles against the prosthesis. It will end by having some ulceration, and the patient will, and I saw patients with this condition, relaxing that hyperactive muscle which press on the braces or the prosthesis, it will be very, very effective in the improvement of the patient. Training the patient to get used to new denture. As you know, if the patient getting the new denture, especially the complete denture, and the patient has a strong muscles, he will dislodge the denture. بيحط الدنشر ويدفه بعضلاته. It will be very good denture, well-fitting denture, but the muscles of the patient are very strong that it dislodge the complete denture. What you do actually, you just weaken that muscle which dislodge the prosthesis by injecting it with Botox. Then the jawline contouring, I mentioned it previously, in the hypertrophy of masseter muscle can be done by the dentist to to make more tapered jawline. From previously mentioned, is there any advantage for the Botox? Is there any advantage? Yes. Psychological benefit to the patient, of course. Minimally invasive. Minimally invasive, most of the cases, not all the cases, but most of the cases, we use insulin syringe, the 6 millimeter insulin syringe to inject. Very non-invasive. Are there any disadvantages? Yes. Like what? Short-term effect, cost factor, and asymmetrical or unnatural appearance. Short-term effect, it's written in books and literature that short-term effect is disadvantage. For me, I don't see short-term effect is a disadvantage. I see it's an advantage. Why? Because if the patient does not like the result, خلاص, he will go back to his norm, يعني 3 to 4 months and finish the effect of it. It's temporary. But like the plastic surgery, if the patient go through it, no reversible. خلاص, it's irreversible. It will be with him على طول. So this is, for me, I don't like it to be disadvantage. I would like to put it in the advantage, but in the books and literature, it's written as a disadvantage. The second thing is cost factor. Well, cost factor, it's relatively expensive, especially the good brands. The good brands should be expensive. Asymmetrical and natural asymmetrical, yes, depends on the practitioner, how he inject, how much he inject, how much he's very careful when he inject, to inject the same amount, same side, so the patient will not take different result on different sides or sides of his face. In the same time, the practitioner should know the anatomy, that some of the patients, they have some variation of normal. Not all the persons have the same anatomical. Some, they have one side different than the other side. So we have to take this into consideration. Unnatural appearance, yes, if the practitioner or the injector does not know what to do and where to inject, yes, the patient will have unnatural appearance or mask face, or maybe it will affect the function of his mouth, speaking, or maybe he will give him asymmetrical smile or mask face, upper eyelid ptosis, lower eyelid ptosis, brow ptosis, frontally ptosis. So yes, this can happen. What are the contraindications? Logically, the contraindication, pregnancy and breastfeeding, because it's a toxin. It's the name, not Botox, it's botulinum toxin A. It's the toxin, so pregnancy and breastfeeding should not be injected. Inflammation or infection in the side of the injection, hypersensitivity, any patient hypersensitive to botulinum toxin should not be injecting. And you have to test allergic reaction, and very easy test. I'm sure all of you know how to test it. Then the neuromuscular disorder, botulinum toxin, it causes relaxation of the muscle. If the patient already has neuromuscular disorder and he has relaxed muscle or paralyzed muscle, you inject him with something which will make these muscle more weaker? No. So it's absolutely contraindication. Then antibiotic, the use, if the patient is using broad spectrum antibiotic, you should not inject him until he finishes the course of his antibiotic. What is the side effect? The side effect of the Botox, as you see here, many side effects: pain, inflammation, tenderness, bruising, nausea, minimal. Well, alhamdulillah, never face any of these side effects with my patient, but it's mentioned. Dizziness, dry mouth, of course, all these with if you inject it in the salivary gland, it it will surely end with dry mouth. If you inject it beside the eyelid, of course, dropsy or ptosis. So the side effect depends on the injector. Well, I see the time is running so fast, so excuse me to just go little quicker in my slides. Okay. Well, they mentioned that botulinum toxin may go away from the area of injection. Yani you inject it in some area and the side effect will appear in other area. Yes, if you inject it deeply, if you inject a lot of amount, if you inject a very high concentration, it's علم. هو علم. So you have to know this المادة هذه, you have to know everything about it to work with it. Botox informed consent is very, very, very important before touching the patient. Before you do anything for the patient should know all these side effects. The patient will come to you knowing the benefits. You will tell him these are the side effects. Inshallah, it will not happen, and it will not happen, inshallah. But it is there. It could happen. يمكن تحصل في المليون واحد. But rare things happen. Rare things happen. ما هو بكل مرة نقول ما يصير ما يصير. لا, it could be. Okay, and I like to put here a cautionary statement to all who's listening to my presentation today, that a little knowledge is very dangerous. Little knowledge is very dangerous. If you want to work with something, you have to know everything about it, and it's not easy to know everything about it. You have to study it. You have to practice it very well. Well, the conclusion from the first part of my presentation justify the title that the Botox is a poison that heals. It's a poison, but it gives, if it's correctly done, it gives a very beautiful and good result. Well, here I will present my research. First research about the management of Botox by injection of management of bruxism by injection of Botox. What is bruxism? As you know all, bruxism, excessive grinding of teeth, and usually it's not related. It's not related to normal function, not to speaking, not to talking, just the patient will keep on grinding his teeth. It's a common problem, and between different population and different study is said from 8 to 31% of the population at certain time of their life, they will have some bruxism. Well, and all the side effect of the bruxism, I'm sure, pain, headache, fracture of teeth, hypertrophy of the masseter, and before the use of Botox, we used to give the patient analgesic, muscle relaxant, mechanical device. Some of the patient, 30% about of the patient will improve, but there is a number of patients, they will not improve by all these conditions, all these methods. So the objective of my study was to investigate the effect of botulinum toxin in management of masseter muscle pain and spasm. Actually, the sample was 50 patients, 50 females patient, 25 patient I injected them with botulinum toxin. After there is inclusion criteria, exclusion criteria, there is informed consent, all the procedure of the research done. And 25 I injected them with botulinum toxin, and 25 I used the traditional method of treatment. I won't go in detail in this, but this is one of my patients. Hopefully you will see that. See, you can see she's grinding her teeth. Okay, this is the other side of the same patient. Okay, you have to look where to inject. Okay, this is one of the patients, as you see. يعني suffering, and her family are suffering from the condition. تخيل طول الليل وهي كده. This patient with Parkinson's disease. Okay. This is one of the patient after injection.
كنت أعاني من ألم فكي في وجهي، بسبب شد على الفك. بعدين جيت عند الدكتورة حصة أعطتني بوتوكس في أماكن في وجهي. الحمد لله الحمد لله الألم يعني 99% راح. الحين أنا جاية جلسة رتوش الحمد لله، يعني فرق السماء على الأرض الحمد لله.
Okay, this is the same patient talking a while ago. See how she grinds. See the wearing facet on her teeth. This is, okay. In conclusion of this bruxism research, that Botox provides successful and satisfactory clinical improvement in patient suffering from bruxism compared to traditional means of treatment. And my paper 2017 published research 2 about management of gummy smile by injection of Botox. As you know, a smile is the most recognized facial expression, and it is considered universal friendly greeting in all culture. The essential goal of the dentist is to achieve a pleasant smile. Some people are impressed about it and maybe psychologically affected by their gummy smile. Okay, the frame of the work of the smile, lips, gingiva, and teeth, and showing a lot of gingiva, it's undesirable. Usually treatment, Lefort 1 osteotomy, myectomy of the muscle, or crown lengthening. I treated my patient with injection of Botox. Well, this is the method of the research, but I used the Yonsei point for the injection. Just I will show you the, because we have only about 5 minutes, so I will go, okay, about the cases. Well, this is the case before. She came for retouch, and this is the case before. She came for retouch, and this is the patient. Well, no filler, nothing, because her lips relaxed. It seems that with more fuller lips. This is the patient pre and post, 2 weeks. This is another patient. Just I will go through the patients. This patient came to me complaining of her gummy smile. Then I told her, Habibti, you have a more serious problem than your gummy smile. She has gingivitis, maybe periodontitis. She has defective restoration, inflammation. And I told her, go and have your teeth done. I injected her with Botox, but I advised her to go to see some dentist to restore her teeth. I referred her to hygienist. Okay, after 1 year, she's one of my patients. See, this is, and she took care of her teeth, and she had some veneer and very beautiful smile. Another case. Just I will go with the cases so quickly, معلش. These are the patient who agreed to be photographed. يعني alhamdulillah, I have a lot of alhamdulillah cases. Some of the patients, as you know, they don't like to be photographed. Some of them they like. Pre and post, a huge difference, as you see here. Look at this patient. Well, Botox injection for gummy smile, it's a very, very beautiful result for the patient with short upper lip. If the patient having a very short upper lip, it will give him, even if there is skeletal abnormality, it will give a beautiful smile. Pre and post. Pre and post. This is pre and post. I published this, alhamdulillah, في International Journal of Aesthetic Dentistry 2019. Okay, the conclusion that botulinum toxin injection for the improvement of gummy smile, it's very effective, non-invasive. It's better if it's give a good result than full mouth reconstruction, orthodontic, or orthodontic surgery. And here is some pre and post injection of my patient, or pre-post. Okay. Thank you. I did not talk about the filler because the time limitation, but it's already with me. But I see that how I looked at the time, it's almost one part of the presentation. But inshallah, with the next annual, the second annual symposium on web, will inshallah يكون physical attendance. Inshallah, بإذن واحد أحد, we will talk about the dermal fillers and give an idea about these fillers.
Thank you very much, Dr. Hissa, for your inspiring presentation. It is an interesting topic that you presented in a unique way. There are a lot of questions, but because of the time, I will take one. One of the questions says, hyperhidrosis treatment by Botox. Does it have a short-acting or a long-acting effect?
Yes, very good question. This is a very good question. Hyperhidrosis can be effectively treated by Botox. From my experience, if you inject the patient first time, it will it will give very good result. The 3-4 months it will come. Then you'll inject him second time. Then it will take not 3-4. It will take maybe 6 months. Then the third injection appointment, يعني بعد سنة مثلا, it will last more. And some of the patients, especially I'm talking about hyperhidrosis underarms and face, underarm mainly, it will last maybe 1.5 years, يعني 18 months. If he regularly do 2 sessions, then كأنه الخلايا المفرزة للعرق سبحان الله there will be less secretion, then he will have it for 2 years or occasionally, يعني يصير regularly. Yes.
Okay. So on behalf of the organizing committee, I would like to thank you again, Dr. Hissa, for your valuable contribution. And you are always welcome in our annual conference. It's an honor to have you, Dr. Hissa.
Okay, thank you. Thank you. Thank you.
Now we will move on to the next speaker. Dr. Ahmed Abdurrahman Al-Malik. He is a senior registrar endodontist and head of infection control department in Hayel Dental Center. In 2007, he graduated from Masr University of Science and Technology in Egypt with a bachelor degree of dental and oral surgery. He received an infection control diploma certificate from MOH GCI in 2013 in KFMC. Then in 2017, he was awarded the Saudi Board of Endodontic Certificate. So currently he's an infection preventionist in addition to a senior registrar endodontist. It's an honor to welcome the distinguished guest from Hayel, Dr. Ahmed Al-Malik.
Thank you so much. Is my voice clear?
Yes, it is.
First, I want to thank the Central Second Health Cluster for inviting me, Dr. Sami, and all the organizers for their efforts. And today I'm going to talk about providing dental services during COVID-19 pandemic. It's not the reopening now. It's now we are the dental services since maybe 3 months come back to work, and I'm going to talk about because I have about 50 minutes. I'm going to squeeze the lecture and give you the important points related to this topic. Okay, the logo of this period during COVID-19 pandemic is نعود بحذر, which means we have to be careful. What does it mean to be careful? You have to practice. I'm talking about healthcare facilities, all facilities in the community. You have to be careful. You have to wear mask whenever you come in contact with many patients, many people, and practicing hand hygiene. Also the practicing of physical distancing, keeping 2 meters between people, and also the social distancing and decreasing the amount of meeting at this time of the pandemic. The key points for my lecture is respiratory triage and standard precautions, transmission-based precaution, air control, engineering control. I will focus on those points too, because there are many questions related to those points. So I will try to make it as simple as possible. I took most of the information from the guidelines for reopening of dental services from MOH, the version 2. And as I believe the version 3 will be available within the next few weeks, inshallah. Okay, first let's talk about the chain of infection. The infection results from interaction between an infectious agent and susceptible host. This interaction occurs by means of contact between the infectious agent and the host and affected by the environment. Breaking the chain of infection by interrupting transmission is generally the best way to prevent their transmission. Okay, this can be achieved by the application of standard precaution or transmission-based precaution. So the chain of infection consists of, as you can see here, the infectious agent like viruses or bacteria, and reservoir, the place or the environment in which the infectious agent lives in, portal of exit, how does the infectious agent exit from the reservoir, like through respiratory tracts or genitourinary tracts. Mode of transmission, we have 3 modes of transmissions, droplet, airborne, and contact. The droplet, any molecule is larger than 10 micron, it's considered as to be as a droplet. Less than 10 micron will be considered as airborne. And for contact, we have 2 parts, the direct contact from person to person, or indirect by touching contaminated surfaces and getting the infection. The portal of entry is how the infectious agent enters into the host, like the respiratory tract, and the susceptible hosts like humans, in which the infection will enter. I'm going to talk about the respiratory triage. Respiratory triage, it is now, as a worldwide, it's applied for not only for healthcare facilities, we can see it everywhere now. They are triaging people, trying to control the people who enter any facility. But for healthcare facility, there is a special triage forms and technique to make sure that the person that enter the facility are identified if they have any respiratory symptoms. So the goal of respiratory triage is to identify persons with potential respiratory infection and thus reduce the chance of spreading infection inside the facility and through the community. We have 2 types of respiratory triage applied for dental setting. Distant triage, when some person or a patient call for getting appointment and call the clinic, and they have to ask him and fill the triage form from the MOH, ask him about if he has any symptoms, he experienced any fever, anything, any exposure risk, by telephone, and this can be arranged before the patient arrival. The second type is triaging upon patient arrival, which is a visual triage. Please, this is a very important point. The person who is working in this triage station has to be a well-trained person and familiar with all the details of the triage form, and all the triage form has to be updated following the MOH forms. So triaging is not only measuring the body temperature. If the patient has no fever, so you let him enter, this is not accepted. You have to ask the questions inside the triage form. If you have any sore throat, you have any difficulty in breathing, and all questions have to be asked to the patient, also for the staff. So please, the triage is not only measuring the body temperature. I prefer to do double check, like if you are doing triage for the patient coming, like let's say there is one patient coming and they take body temperature and they write his body temperature is 37.5, then they ask him the question and he gets score 3. Okay, then I prefer to make the patient take a copy or take this paper and go to the dental clinic for his appointment. Before starting the procedure, the dentist or the dental assistant will do the triage questions again. We'll ask him again. After that, he can fill a disclosure form and keep all in the form and the disclosure form in his file as a document. So to make it as extra precaution. So again, a well-trained dental assistant has to be in the station and not only measuring the body temperature, please. So the second important point is healthcare workers must be triaged twice daily, once before entering and once before leaving, or at least once before entering. Okay, after triage, both the patient and the dental healthcare worker has to get pass card or any proof that they have been triaged. Okay, it is very important. Many of the infections happen in the healthcare facilities worldwide is mainly come from community. Some person catch the infection from he visits some friends or something and catch the infection and come to his facility and transmit the infection to them. So we have to be careful. Okay. Requirements of visual triage. The requirements of visual triage, the location of the triage station must be as close as possible to the facility entrance to control, to catch any person with any sign or symptoms for respiratory disease before entering the facility. The second thing is a designated area or table with a clear poster of triage. You have to put a clear sign in the table or in the entrance to direct the patient that there is a triage. This is the triage station, and direct if you can put some like barriers to control the pathway for the patients to not let anybody enter from without triaging. Okay. Again, a well-trained dental assistant in the triage form and how to score the patient is very important. The following supplies are provided in the triage station. You have to provide face mask, tissues, touchless waste container, and alcohol dispenser. And please, you have to make sure that the patients entering the dental facility, they have to wear mask, and also you have to make sure that they practice physical distancing. An updated triage form must be available. Any update in the triage form must be followed. You can see here, this is one triage station in Heil Dental Center. You can put some stickers on the floor to control the patient to practice physical distancing. I personally prefer that the staff have a different pathway for triage to avoid traffic. As in the morning, maybe patient coming and staff coming, you can make a different pathway for the staff with a different dental assistant to triage the staff, and a different pathway for the patient to do triaging. So let's do it again. Let's say first you have to do measure body temperature using non-contact infrared thermometer or forehead thermometer. Okay. After that, you will fill the triage form. This is the last updated triage form. As you can see here, there are two parts: exposure risk and clinical signs symptoms. Okay, so this is very important. That if the patient is not experiencing any sign and symptoms, So this one will be 0 if the patient doesn't have any sign and symptoms. So the exposure risk will be 0, as it's mentioned here, prior to symptoms onset. Okay, let's take example. For example, patient came, he said, I have sore throat and rhinorrhea, okay, since 2 days. So you'll give him either pediatric or adult, you will give him score 1, okay. After that, you will go for ask for exposure risk. Now he has one of the symptoms. You will go for ask him, do you have a contact with confirmed case of COVID-19 or MERS-CoV in the last 14 days? If he said yes, he will take 3. What about if he said yes for contact and yes for exposure to camel and yes for work in facility with the COVID-19 outbreak? You put 9? No, you will put only 3. So 3 plus 1, it will be score 4, which will be highly suspected. Okay, what about the patient come? He said, no, I don't have any symptoms. I don't have any symptoms, nothing. So it will be score 0, okay? So we have 3 scores. Score 0, from the triage 4, patient is not suspected. As you know, in crime scans, when there is any crime, they will ask for any evidence or something that could be related to the crime. And if there is evidence that somebody is suspected, he will consider as suspected. So for us, we are talking about sign symptoms. If there are no sign symptoms, so the patient is considered not suspected. Okay, so you will work, if you are going to do aerosol generating procedure, you will use handpiece, use ultrasonic, no need to wear respirators, no need to do the air control. You can resume work as normal. You will wear surgical mask, isolation gown, face shield, or goggles, and the clean gloves. Okay, so the patient is not suspected. And score 0, as I can see in our dental center, is the most common score. Most of the patients are score 0. No need for any special precautions. Okay, how about if we have score, the second score is less than 4, like 3 or 2 or 1. Patient has low suspicion. So for such patients, I did not see maybe 3 patients in 2 months, 3 patients scored less than 4. You will deal with them. For such cases, you can wear respirator N95 or bubber. I will talk in details about the respirators in the next few slides. How about air control? If you are going to work for this patient, you will, as I said, you will wear the N95 or bubber. You have to keep time lapse at least 1 hour between each patient for ventilation. So this is related to score less than 4. Okay. How about patient score equal or more than 4? Patient has high suspicion. Okay. So for this patient, you have to have good air control, and you have to wear your respirators and or N95 or bubber, but you have to have HEPA filter or HVAC system with negative pressure room, or do it in portable dental clinic inside AIIR. And I will go to explain in details the air control. So please score 0, no need for any precautions. Okay. After the Hello?
Yes, doctor, please proceed.
Okay, sorry for this interruption. Now, this is the disclosure form. This disclosure form is, as I said, you have to do double check. Okay, in the clinic, the dentist or the dental assistant will do triaging inside the clinic for making sure that the triage is accurately followed. And after that, the patient will sign for this disclosure and keep it in the patient file. Okay, let's talk about the standard precautions. Standard precautions. We are, as a dentist, before the COVID-19 pandemic, we following the standard precautions. What are the standard precautions? They are a set of infection control practices used to prevent the transmission of diseases that can be acquired by contact with blood or body fluids or mucous membrane. So infection control measures during the COVID-19 pandemic must be accompanied by all standard precautions in normal situations. Okay. The standard precautions, we have hand hygiene. They are hand hygiene, personal protective equipment, respiratory hygiene or cough etiquette, sharp safety and waste management, safe injection practice, sterilization of instruments and devices, cleaning and disinfection of environmental surfaces. But today, because I have the time, limited time, I will focus on the personal protective equipment. Okay. The use of rotary dental instruments like handpieces and the use of air-water syringe creates visible spray of droplets of water that contain saliva, blood, microorganisms, and debris. Okay, we have to differentiate between the droplets or spatters that they are bigger than 10 microns. They will not travel for a longer distance. They will fall down after within 2 to 3 meters. But for the aerosols less than 10 microns, they can be suspended in the air for a longer time. So we use our PPE to protect ourselves. Definition, specialized clothing or equipment worn by an employee for protection against infectious materials. Okay, types of PPE. Protective clothing, like to protect the skin and clothing, like the isolation gowns. Gloves to protect hands. Face protection, like goggles and face shields. Head cover or cap for protection of head and footwear. This is surgical mask. Goggles. I personally prefer to use at this time to use tight fit goggles, not this type. The tight fit is like the swimming goggles to provide more tight seal. Face shield, clean gloves, respirator or N95, isolation gowns, head cover, foot cover, and this is bubber. Bubber is referred to powered air purifying respirator. This is a respirator like the N95. I want just to make sure that and inform you that N95, when it is indicated, like you are dealing with high score, like equal to 4 or more, or dealing with the confirmed case with the air control, good air control, the N95 has to be fit tested. What does it mean, fit test? Fit test, like that there is a special test. You wear the N95, and after that they spray some like sugar or something like that, and wearing a hood. And if you test this sugar or whatever the liquid used, so you have leakage, even if it looks tight fit for you. Some they are wearing randomly, and they said, this is proper for me. This is the proper size. No, there is something called BICSL or Basic Infection Control License. There is a special test for making sure that the N95 is fitting to your face and provide protection. Otherwise, there is no benefit from using it. The second thing is for the male doctors. Most of them, they have facial hair or beards. If you are using the N95 while you have beer, also you will not get any protection from the N95. So they can go for the bearded person, they can use the bubber. I'm talking when it is indicated, when you are dealing with highly suspected cases. For score 0, please, there is no need, because almost no risk, or there is no suspicion for this patient. So you are going for score 0, you will use the surgical mask, and they are the most common patient visiting us are score 0. If you are dealing with suspected cases and you are going to use respirator, please make sure you have to be fit tested, okay? And if you have facial hair, you will use the bubber. Okay, factors influencing the PPE selection. The selection of PPE depends on 2 important factors: what kind of a procedure you are going to do, and what is the scoring of the patient. Okay, so the procedure that you will do is either it's aerosol generating procedure or not. I'm going to give you the definition of aerosol generating procedure. It's mainly when you are using handpiece or ultrasonic. This is called aerosol generating procedure. And the second thing is the scoring from the triage station. After that, you can decide what kind of PPE you will use. Okay. I'm going to talk about the transmission-based precaution. Transmission-based precautions are more advanced than the standard precautions and mainly used for isolation rooms. They are a set of practice that apply to patients with documented or suspected infections, for which precautions beyond the standard precautions. You need to do more than standard precautions for protection of the staff and the patients. According to the CDC, they are contact, droplet, or airborne. For contact, you will use gloves and gowns, and for droplet, surgical mask, and for airborne precaution, use a N95 respirator. So, SARS-CoV-2 mode of transmission. According to WHO, CDC, and Saudi MOH, it is droplet and contact transmission. Okay, but sometimes when we are using, we're dealing with high suspected cases, with fever, coughing, and he has emergency, and you have to treat him. You are going to do aerosol generating procedure using hand pieces or something. You have to use the respirators, and you apply the airborne precautions. Be negative pressure room or HEPA filter. This is for highly suspected cases. Okay. So the definition of aerosol generating procedure: a procedure capable of generating hazardous droplet nuclei less than 10 micron. So the aerosol generating procedure have been associated with increased risk of transmission of viruses like SARS-CoV, MERS-CoV. The use of dental handpieces, ultrasonic, or tracheostomy, or cardiopulmonary resuscitation are examples of aerosol generating procedures. As you can see here, use of handpieces, mix sprays or aerosols or droplets, different types or sizes of molecules spread in the air. What does CDC recommend in case of treating suspected COVID-19 cases? So suspected means has symptoms. Not suspected means no symptoms, no single symptoms. So we have score 0, we will not apply this. We will resume work as normal using surgical mask, as routine. But if you have suspected COVID-19 cases, you will use, as I mentioned, a fit tested N95. If you have facial hair, you will use the bubber if available. And you will use the clean, non-sterile long sleeves gowns and gloves. Limit the number of persons present in the room to be an absolute minimum. Okay, now I'm going to talk about the air control. Air control is very important. We are focusing mainly when we are dealing with suspected or confirmed cases. For the guidelines from the MOH, they provide different options for treating different type of risk related to COVID-19 patients or suspected COVID-19 patients. So the air control mainly related to people who are highly suspected or confirmed to have COVID-19. So HVAC system, which is heat, ventilation, and air conditioning systems, and also air handling options for any dental aerosol generating procedure for suspected or confirmed cases, which are dental clinic with a negative pressure HVAC system, portable dental clinic inside AIIR in hospital setting. AIIR هذه اللي هي airborne isolation rooms related to airborne patients like TB. If you are going to do an AGB for positive case, it has to be, you can use portable dental clinic inside AIIR in hospital setting, or you can dental clinic with portable HEPA filter with airborne precautions using N95. This is example for HVAC system. It has a special exhausting and air supply system. This is also an example. How about the negative pressure rooms? Negative pressure rooms, as I mentioned, it's for airborne diseases, or if you are going to do aerosol generating procedure for positive coronavirus patient or highly suspected case, like they are doing in hospitals when they are doing swabbing, they are mainly using the negative pressure rooms to control if there is any aerosols during this procedure and wearing N95. Portable HEPA filters, also one of the options when you are dealing with suspected cases or confirmed cases, portable HEPA filter with airborne precautions. Okay, recommended time lapse before starting terminal cleaning and disinfection. After treating patients whose triage score is more than 0. Yani let's say if you are dealing with like patient score 3 or 2 or 1, and in a neutrally air ventilated room, as I said, it's low suspicion, but you have to keep minimum 1 hour between each patient. How about score 0? No need for this time lapse. But if you are going to deal with highly suspected cases and you are doing in a negative pressure room, the time lapse is 20 minutes. HEPA filter, it will depend on the manufacturer instruction, the time lapse that will give you good air filtration before starting cleaning and disinfection. So this is very important. Okay. For this is the flow chart available in the guideline from for the dental clinics, for reopening dental clinics. Please, you can print this flow chart. It will make it easy for you. You can print it, keep it in your clinic, and you can print it, keep it in the triage station, and you can follow what is in this flow chart. It will make it easy for you. Let's take an example. If the patient upon arrival came and we filled the triage form, as I told you before, then the score become 0. Okay, patient has no symptoms, nothing. So what we will do for score 0, you will follow this flow chart. Resume dental work as normal. Either you are going to do aerosol generating procedure or non-aerosol generating procedure. You will resume work as normal. You wear your normal PPE, isolation gowns, surgical mask, face shield or tight fit goggles and gloves. Either aerosol or non-aerosol. This is for related to score 0. So please, you have to follow this flow chart. Okay, what about the patient is less than 4? If you are less than 4, if you are going to do a dental procedure, if non-aerosol, okay, you will resume work as normal. You will wear surgical mask, isolation gowns, face shield, and clean gloves. How about aerosol generating procedures? You will keep ventilation 1 hour between each patient and wear respirator with hair cap, face shield, tight fit goggles, and clean gloves. Or if you are not going to wear N95 because you have facial hair or something, you can use surgical gown bubble and gloves. This is a second option. Okay, this is for score less than 4. Okay, so I hope it's clear. How about score equal to or more than 4? If urgent dental procedure, this is highly suspected patient. If he has any emergency, you have to manage, you have to apply those precautions. As I mentioned, if you are going to do aerosol generating procedure, the air control you have to be followed. As I said, the dental clinic with a negative pressure room, HVAC system, or a portable dental clinic inside AIIR in hospital, or dental clinic with portable HEPA filter with airborne precautions. Will be options. It will be surgical gown, N95, hair cap, face shield, tight fit goggles, and gloves. Or the second option is surgical gown, bubble, and gloves. Okay, this is an aerosol generating procedure for highly suspected patients. Okay, and you can apply it for confirmed cases also. How about non-aerosol generating procedure? You are not going to use handpiece or ultrasonic. It's okay. You can examine the patient wearing the surgical mask, face shield, and the isolation gowns and the clean gloves. Okay, but for score equal to or more than 4, the patient has to ask to make sure that he is wearing mask and report to infection control in the facility and refer the patient, direct the patient to go to Tatamman clinic for doing test. So I hope this is clear. As I mentioned, this is better to be printed. This is the most important thing. This is what will control your work. You will print it and keep it in your clinic or in the triage station. It will make it easier for you to do your procedures. Okay. What about engineering control? Engineering controls are many devices, ideas available, but we can see now there is a new trend of engineering controls, which is the extraoral suction or extraoral vacuum. Though there is no substantial evidence to support the significant role of these measurements in the prevention of occupational acquired disease, but it's worth to be mentioned as it contains. I will show you. There is one example in the next slide. It will control. It give you some air control and filtration. As you can see here, this is one of the systems. This is an extraoral suction, and they claim that there is HEPA filter, which provide 99.97 filtration of air. Also, there is ultraviolet light for disinfection of air. So I think those engineer control, there will be more ideas or more innovations in the next few months, and it will be, I think it will be as a routine in the near future. Okay, let's take one scenario. The scenario is a patient came to dental center for elective treatment. At the triage station, the dental assistant measured the body temperature, and it was normal. During asking about other symptoms, the patient said he don't have any other symptoms. So what score should he get, and what precautions have to be done? Let's do it together. Patient has the body temperature is normal. He said he don't has any other symptoms. So the score will be 0. So score 0, you will resume dental work as normal. Okay, even if you are going to do aerosol generating procedure, you will wear surgical mask. You will not need to have this time lapse between each patient. Okay, now I have this scenario number 2. Please, I want the polls. I sent a question in the polls. I want my audience to answer this scenario. If it's possible to put the polls now, the question. Okay, let's read the scenario together. Patient came to a dental center for elective treatment, and at the triage station, the patient has normal body temperature, but he had sore throat and headache since 2 days. After asking him about the risk of exposure, he said that he works in hospital that reported 3 COVID-19 cases among staff in the past 10 days. So what is the score of the patient, and what kind of precaution has to be done to treat him? I hope the pulse is now available for the audience. Give you time to, okay, let's do it together. So what is the score of the patient in the previous scenario? Is it score 0, less than 4, more than 4, or equals to 4? Okay, patient normal body temperature, but he has headache and sore throat since 2 days. So he'll get either adult or pediatric. He will get score 1. Okay. So we have symptoms. We are going to ask about the exposure risk. He said he worked in a hospital that reported 3 COVID-19 cases in the last 10 days. So he will get score 3. So the patient, what score will get? Can I have the results of the polls, please, if it's available, before putting the answer? If the result of the survey is available, please. Okay. Let me know if the results are available to see how many person answered the correct answer.
Just a second, Doctor. I think they're working on it. They didn't send it yet.
Okay. So I put the scenario again until they're ready to remind you to read it again. I'm focusing on the triage because I think it's the most important point at this time of the pandemic. It will control everything. Okay. Okay. I want to see, I'll give you some 1 minute to answer. Okay, can I have the results now for the survey? Can we share the results if it's available? See how many person answered it correctly. Okay, I have the results now. What I see is 28%. The correct answer is score equal to or more than 4, which is 28% answered correctly. Many are scored less than 4, 55%, which is a wrong answer. Score 0 is 17, which is wrong answer. Okay, that's why I want you. I made this scenario to make sure that everybody is understanding. So I will repeat again. Let's do the scenario together again. As I said, triage is the most important thing for dental clinics and all hospitals at this time. Patient came to a dental center for elective treatment and at the triage station. The patient has normal body temperature, but he had sore throat and headache since 2 days after asking him. So we have sore throat and headache. After asking him about exposure risk, he said he works in hospital that reported 3 COVID-19 cases among the staff in the past 10 days. Okay, so the correct answer is C. Why? Let's go. Headache, sore throat. So we'll get 1. He worked in a facility known to experiencing an outbreak of COVID-19 in the past 14 days. So he will get 3. So it will be 4. Okay. What does it mean outbreak for in the facility? For any emerging disease, if you are reporting even single case of COVID-19 disease, it is considered as outbreak. So I have to keep this in mind. Okay. So I hope it be clear for you. Now the correct answer is score 4 and more. So he considered as high risk. So it's better to, if he has urgent need urgent treatment, you will try to manage him, but with special precautions. As I said, the air control. If you are not going to do aerosol generating procedure, you do examination or non-aerosol generating procedure, it's okay. But you have to refer this patient for Taman clinic for getting tested because he is highly suspected patient. Okay, and you can manage if he is, if you can manage by do pharmacological management and advice. So, not something very, very urgent. You can manage until he get tested. So this is the second scenario. I hope everybody try to follow this flow chart, and it will be easy. Do it again and again, and you will try to. It will be. This is the summary for the whole guideline. And if there is anything will be changed, it will be available in the new guideline version in the next few weeks, inshallah. Okay, so this photo belongs to 1918 during the Spanish flu. As you can see here, this is police detectors, and they are trying to catch any person who is not wearing mask and take it to jail. So it's worth to share with you. You can scan this QR for my contact information. For any questions or information, you can follow me on Twitter or send to my email. And those are my references. Thank you for your listening. I hope you get a benefit from my lecture and you enjoy it. And you can have the time now for any questions. Thank you so much.
Thank you, Doctor, for your informative and well-organized presentation that I'm sure everyone found it very beneficial as COVID-19 is still a pandemic. Now it's time for the questions. Okay. She says, good evening. I have a question, please. I did a fit test this week, but when I wear the N95 in the clinic, I still smell the disinfectant. Does that mean it's not fit?
Fit test and dunning and the proper dunning and duffing. Those are more important factors in making sure that you are well protected and you have a good seal in the 95. So the fit test, you will not smell. You are putting a hood. If anybody did the test, like our colleague here mentioned, she did the test. It's very strict. If you smell anything or spray and taste any sugar from the spray, this means you have leakage. You have to change. So maybe you are not dunning properly. You have to do. You can refer to the proper dunning and duffing of the PPE and specifically the N95 respirator. Maybe you have some problem with the dunning. So if you are fit tested and they give you like your size small, Kimberly, whatever. So if you are fit tested and approved that you are fit tested for this specific size, so you pass that test. So if you have leakage or smell, abnormal smell or something, you have to make sure that you are properly dunning the respirator.
Thank you, Doctor. So on behalf of the organizing committee, I thank you again for your valuable contribution.
Thank you so much. Thank you so much.
So we will move on to our next speaker, Ms. Ghada Zaid Al Masoud. She's a dental hygienist in King Fahd Medical City. In 2013, she awarded her bachelor degree from the College of Applied Medical Sciences in King Saud University in Riyadh. For the past 3 years, she has been working in dental health awareness community programs. It is a great pleasure to welcome you, Ms. Ghada. Are you ready, are you ready? Ms. Ghada? I'm sure all our hygienist colleagues are very excited to hear this presentation from you.
Can start now?
Yes, Doctora, you can start. Everything is ready.
Yeah. Assalamu alaikum, everyone.
وعليكم السلام ورحمة الله وبركاته. تفضل يا دكتور.
First of all, I would thank you all for attending this first annual web symposium of dental services. And let me introduce myself. My name is Ghada Al Masoud. I'm a dental hygienist from King Fahd Medical City. I'm looking forward to talking with you today, inshallah, regarding a very important topic. And I think it's very useful, especially for us as a dental hygienist in a clinic during this pandemic day. So today, inshallah, we are gonna discuss the risk of getting COVID-19 as a dental hygienist in the clinic. But first, let's talk about the COVID-19 itself. What is COVID-19? As you can see here, coronaviruses is a large family of viruses which may cause illness in animals or human. In humans, several coronaviruses are known to cause respiratory infection, ranging from the common cold to more severe diseases, such as MERS, Middle East Respiratory Syndrome, and SARS, Severe Acute Respiratory Syndrome. The most recently discovered coronavirus caused the coronavirus disease COVID-19. It's a new illness that can affect your lung and airway. This new virus and disease were unknown before the outbreak or pandemic start began in Wuhan, China, and last of 2019. The name of the virus of COVID-19, it's called SARS-CoV-2. On February 11, 2020, the World Health Organization announced the official name of this disease that causing the 2019 novel coronavirus outbreak. First identified, as we said before, in Wuhan, China. The new name of this disease is coronavirus disease 2019. So now COVID-19 is abbreviation. CO stand for corona, VI for virus, D for disease, and so that disease was referred to as 2019 novel coronavirus. This is the list of the symptoms of COVID-19. You will find the common symptoms and the least common symptoms. The common symptoms is to start with a fever, cough, shortness of breath, sometimes develop into pneumonia in severe cases. For least common symptoms, itches, pains, sore throat, diarrhea, headache. Some of the patient exhibit loss of taste or smell, and rash of skin and discoloration of fingers and toes. This disease can cause severe complications, especially in people with medically compromised people and older people and person with chronic disease, as we said before, medically compromised, and person with immunodeficiency, such as cancer, diabetes, lung disease, and heart disease, and the other type of disease. The transmission of SARS-CoV-2, this virus that caused the COVID-19, can occur through direct, indirect, or close contact with infected people through infected secretions such as saliva and respiratory secretion, or through their respiratory droplets, which are greater than 5 to 10 micrometer in diameter. The droplet less than 5 micrometer in diameter are referred to as droplet nuclei or aerosols. So now we will discuss what is the aerosols. Aerosols is particles less than 50 micrometer in diameter. Particles of this size are small enough to stay airborne for extended period before they stay on environmental surface or to enter the respiratory tract. The smaller particles of an aerosols, 0.5 to 10 micrometer in diameter, have the potential to penetrate and loaded to the small passages of the lung and tough to carry the greatest potential for transmitting infection. This aerosolized droplet nuclei can remain in an area suspended in the air even after the person who emitted them has left, and those can infect healthcare workers and also contaminate surface. In this picture, you can see the amount of the aerosols can be generated from the one infected person, and how much they can travel. This aerosols can travel through the distance. It's greater than 6 meters for the large spray droplet. Here you can find that the longevity of COVID-19 in various places. So this virus can viable up to 27 hours after application to plastic surface and also to stainless steel surfaces. Also, it's viable up for 24 hours on cardboard surface. and variable up to 9 hours in Cooper surfaces, and can be suspend aerosols up to 3 hours. COVID-19 can be transmitted in dental clinic mainly in a 3-way by direct transmission through inhalation of a droplet generated through coughing or sneezing or even talking. Direct transmission via exposure of a mucous membrane, such as eye, nasal, or mucosa to the infectious droplet. And direct transmission via contaminated surfaces, as we discussed before in the previous slide. Here, this is the surfaces and the longevity of the virus. The aerosols generating procedures. We should know what is the aerosols generating procedure. It's defined as any medical, dental, and patient care procedures that result in the production of airborne particles less than micrometer in diameter in size and which called aerosols, can remain suspended in the air, travel over a distance, and may cause infection if they are inhaled. So the aerosols generating procedure in dental clinic, these are the list of the dental procedure can generate aerosols. First of all, we start with a 3-way air water spray. And also during dental cleaning as our regular duty with ultrasonic scaler and polishing, also it considers as the greater source of the aerosols. Also during periodontal treatment with ultrasonic, when you're doing dental preparation with high or low speed with hand pieces, during mechanical endodontic treatment, tooth extraction, surgical tooth extraction, and also implant placement. So in this table, really I love this table because you can find here the devices and the airborne contamination, the procedure that can produce the airborne contamination, and also how to control this contamination. So first of all, we will start with our ultrasonic and sonic scaler. As we said before, it's considered as the greatest source of aerosols contamination. So how we can reduce the contamination in the air? By use of high volume evacuator. Imagine the number of reduction in the contamination. It's more than 95% by just using the high volume evacuator. The second one is air polishing. Also the bacterial count and communication indicated that it's nearly equal to the ultrasonic scaler. How to control the contamination by available suction devices will reduce the airborne contamination by more than 95%. Air water sealant, bacterial count indicate that airborne contamination is nearly equal to those when we're using ultrasonic and sonic scaler. And how to reduce the contamination produced by air water sealant by using high volume evacuator. The contamination will be reduced nearly 99%. Tooth preparation with air turbine handpiece, minimal airborne contamination. To control this contamination, it's preferred to use the rubber dam. During tooth preparation with air abrasion, bacterial contamination is unknown still, and extensive contamination with abrasive particles has been shown. So here you can see the visible results could be produced by ultrasonic scaler. Ultrasonic scaler produce the most visible results, and water spray usually used with ultrasonic scaler. It can be the portion of the results, and this result is visible to the naked eye, and it's noticed by the patient and also by dental hygienist. Here you can see this study showed that when we use equipment with water source and when we use it without water source. This study showed that when we use ultrasonic scaler without any coolant water, there still was a large amount of results. This result is from small amount of liquid placed at the operative site. So that contaminated results, it will become from the patient itself, and it will contain like a blood, saliva, and this results can spread from distance to at least 18 inches from the operative site. However, the results from the ultrasonic scaler can arise from both coolant water also as a source of contamination, and also directly from the patient. Now, the composition of the dental results can be different, depend on the patient and also depend on the operative sites. You can find, as I said before, saliva and nasopharyngeal secretion, black blood, and also tooth component. The results, the protection by ultrasonic scaler when no water was used is even in the complete, and even when you use ultrasonic scaler and complete absence of coolant water, there is aerosolization of the material from the patient. So it will be no different when you're using the ultrasonic scaler with water and without water. And sometimes they prefer to use the scaler with water just to reduce the contamination coming from the patient itself. As dental hygienists in our regular daily duty, we are working to the patient in close proximity, face-to-face for a long period of time. We give our patients oral hygiene instruction, and we do scaling for them and polishing. So this procedure can put us in frequent exposure to saliva, blood, and other body fluid, as we said before, and also during handling sharp instrument. So we are consequently at a high risk of being infected with SARS-CoV-2, or can pass this infection to our patient, also can pass it to our families. So this is our question, and this is a very important question: how contaminant the spread of SARS-CoV-2 in our dental clinic. I can give you tips. You can apply it daily, and you should apply it. Tips before going inside the clinic for you also, and for your patient during the procedure, and after and between your patient. So first, we should focus on education more than practical procedure. And as we know, scaling and polishing, it's not essential oral health care. So we should focus on the education more than a practical procedure. And during the COVID-19 pandemic, effective prevention of oral problems and self-care remain a high priority. This according to WHO. Patients should give an advice through remote consultation or social media channels on maintaining good hygiene. As I said before, WHO advised that routine non-essential oral health care which usually include the oral health checkups, dental cleaning, and preventive care, postponed until there has been sufficient reduction in COVID-19 cases, or reduction also in COVID-19 transmission rate from community transmission to cluster cases, or according to official recommendation at national, subnational, or local level. However, for the urgent or emergency oral health care intervention that are vital for preserving a person's oral functioning, managing severe pain, or securing quality of life should be provided. It's so important. You should know that not all people infected with SARS-CoV-2 exhibit symptoms, and cases without symptoms can also transmit the infection to others. So you should put this in your mind and keep it in your mind. Just treat all of your patients like they have COVID-19 but without symptoms. So this is the tips how to protect yourself and how to protect your patient also before going inside the clinic and start your procedure. First of all, you should start with screening. Screening by taking the medical history of your patient and also by taking their vital sign, and make sure their vital sign is in normal are in normal range. Also, it's most important to take their temperature and make sure it's in normal range. Ask your patient if they have been advised to self-quarantine because of exposure to someone with SARS-CoV-2 infection. When you are performing the screening or your colleague perform it, so you should maintain a physical distancing of at least 1 meter. You should wear ideally a glass or a plastic screen to build or to create a barrier between you and between your patient, and also between the staff performing screening. Wearing a medical mask throughout the shift. All oral healthcare personnel should continuously wear a medical mask during their routine activity and throughout the entire shift. But what about if there's a severe medical mask shortage? What we should use? Here, if there is a context severe of medical mask shortage, you can use a face shield as an alternative. But using of a non-medical or clothes mask, it's not considered appropriate for protection of health workers based on available evidence. Prior to treatment, all oral healthcare personnel undertaking or assisting in the procedure should perform hand hygiene according to the WHO 5 moments recommendation by using alcohol-based 60 to 80%. And also you should request your patient to practice hand hygiene on arrival and also throughout the visit. This is the 5 moments of hand hygiene recommended by the World Health Organization. First, you should wash your hand or do hand hygiene before touching the patient to protect the patient from the harmful germs carried in your hand. Before clean aspect procedure to protect the patient from harmful germs, including patient on and from entering his or her body. 3, after body fluid exposure risk. Why? To protect yourself and also the environment from the harmful patient germs. And after touching the patient, to protect yourself and environment from harmful patient germs. After touching patient surrounding, to protect yourself and the environment from harmful patient germs. Here you can find the step of the hand wash, the duration of the entire procedure. It will take like 40 to 60 seconds. And wash your hand when it's visibly soiled. This step is recommended by the also WHO. And here how to hand rub with alcohol. The entire procedure, it will take like 20 to 30 seconds. And also this is recommended by the World Health Organization. So here we are continue before going inside the clinic. You should ask your patient to use a medical or non-medical mask and space schedule appointment. Why? To reduce the number of patients in the waiting room so that patient can maintain physical distancing of at least 1 meter. Patient should be unaccompanied, but if they need real help or require assistance, he can. Only admit the patient and staff required to provide care to the treatment area. Now we will talk about the ventilation. Ventilation playing a very important role during this pandemic, because as we know, the ventilation can reduce the contamination inside the clinic, the airborne contamination, and the aerosols amount in your clinic. So adequate ventilation in oral health care facilities can reduce the risk of transmission in closed setting. According to the type of the ventilation you have in your clinic, either mechanical or natural. The using of split air conditioning and other type of recirculation devices should be avoided, and consider installation of filtration systems such as high efficiency particulate air filter. We know it as a HEPA filter. Here, one study found that ultrasonic instrumentation can transmit 100,000 microbes per cubic foot with aerosolization of up to 6 feet. This is without ventilation if there is no proper air current is present. These microbes can last anywhere from 35 minutes to 17 hours. So that's why the ventilation is playing a very important role inside your clinic, and you should make sure you have a good ventilation system before starting with your patient when you are using the ultrasonic scaler, I mean. Now we will start, or we will discuss the protection tips during the procedure. So you should first set out only the instruments and other materials that are indispensable for the procedure to be performed. And as we said before, you should perform hand hygiene, and if your patient is not performed hand hygiene before entering the clinic, you should ask him to perform it. The hand hygiene should be, you should follow the recommendation of the WHO, the steps of the WHO. Use appropriate personal protective equipment, PPE. The personal protective equipment included gloves and fluid-resistant disposable gown. Also eye protection, face shield. The ideal face shield should cover the front and the sides of the faces, or goggles if it's found. Also, you should wear a medical mask fit tested N95 or any respirator mask if you are doing a generation a results generating procedure, or you are doing scaling. So here you should start with hand instrumentation, and it should be prioritized. But if you are really need to do scaling with the ultrasonic scaler, or you will do a polishing, you should use a high-speed suction or high volume evacuator to reduce at least or to control the aerosolization in your clinic. And don't let your patient spit in the sink, but ask him and instruct your patient to spit into a disposable plastic cup, or you can use high-speed suction. It's better to finish your patient in one visit. And here, this is like the summary of the method of reduction of the airborne contamination during the clinic. So the first, you can see the devices and advantage and disadvantage in this table. For the devices, barrier protection, like we call it personal protective equipment, like masks, gloves, eye protection, and goggles or face shield. The advantage of this device, it's part of standard precaution, and it's also inexpensive. But the disadvantage, the mask will only filter out 60 to 95% of the aerosols. And this mask is subjected to leakage if it's not fit very well. And it will not protect you when you remove it after the procedure from the aerosols. Also, when you ask your patient to rinse with the antiseptic mouthwash, the advantage is reducing the bacterial count in the mouth and also in the saliva and also in the air. Also, an advantage for this device is it's inexpensive as on per patient. The disadvantage it's to be most effective on the free floating organisms, and it will not affect the biofilms organisms such as black subgingival organisms, blood from the operative site, or organisms from the nasopharynx. For the high volume evacuator, advantage will reduce the number of the bacteria in the air and remove the most aerosols in the operative sites such as bacteria, blood, and virus. For the advantage, it's inexpensive also on a per patient basis. Disadvantage, when an assistant is not available, it's difficult to use it. But it's necessary also to use the high volume evacuator and the small bore saliva ejector. It's not an adequate substitute. For the high efficiency particulate air room filters and ultraviolet treatment of ventilation system, it's effective in reducing number of airborne organisms. The disadvantage, it's only effective once the organisms are already in the room air, moderate to expensive, and may require engineering change to the ventilation system. Cleaning and disinfection between your patient and after the patient. So first, you should ensure that the high touches surface, such as door handles, chairs, spawns, reception desk, are regularly cleaned by brushing or scrubbing with the detergent to remove and reduce aerosols before disinfection. And many disinfectants are active against enveloped virus, such as COVID-19 virus. WHO recommends using 70% ethyl alcohol to disinfect small surface area and equipment between uses. Can use sodium hypochlorite at 0.1% for disinfecting surfaces and at 0.5% for disinfection of large blood or bodily fluid spill in healthcare facilities. All patient instrument. All patient instrument, devices, and equipment must be sterilized or otherwise subjected to high level of disinfection. According to subletting criteria or to the manufacturer recommendation. And staff performing cleaning and disinfection should wear appropriate PPE, discard respirators, surgical mask, gown, and gloves after every patient. Reusable eye protection and face shield must be cleaned and disinfected prior to reuse. There are no standard or evidence-based method for reprocessing masks or respirators. Reprocessing should be only considered when there is a critical shortage in PPE. At the end, you should put this in your mind. Impossible to complete eliminating the aerosols generating a procedure, but it's possible to minimize the risk and to minimize at least the aerosols generating during this procedure by applying a simple and inexpensive precaution. As we discussed in this lecture, we can use the when you have a good ventilation system, you can reduce the aerosols in your clinic. When you are, first of all, you should use with hand instrumentation, and when you are really need to use the ultrasonic scaler or polishing, you should use it with a high evacuator, a high volume evacuator. And also before of this, you should take care of your patient by ask them to do hand hygiene and to take the vital sign and make sure he's healthy and he hasn't have any of the sign and symptoms of the COVID-19. You can see here, no single approach or device can minimize the risk of infection to dental hygienist and other patients completely. So you should use the all available methods and devices to control the aerosolization in your system, in your clinic. This is the key role to protect keyword to protect yourself and to protect your patient also, by assuming that all patients you have seen in your clinic have infectious disease and all of your patient is a COVID-19 patient. When you treat them as a COVID-19 patient, you will provide them a high level of for treatment with a high level also of protection for protecting them against the COVID-19 and also to protect yourself and your family. This is my reference. If you are interested to look at my topic and the other related topics, you can visit this links. At the end, I would like to thank everyone, and if you have any question regarding this topic, I'm welcome. Thank you for listening.
Thanks, Ms. Rada, for your very informative presentation that I'm sure was beneficial for both dentists and hygienists to know how to treat patients in the most precautious way during the COVID-19 pandemic. I was revising the questions, but actually none were related to the topic. Most of them, they're asking about how to confirm their attending today. There will be a QR code during break that you will see, and you can scan it and to confirm your attendance. So on behalf of the organizing committee, I thank you, Ms. Rada, for your valuable contribution. Now it's time for a break time. As you can see, for those who are asking, again, I'll explain. You get your smartphone and place the camera on the QR code in front of you on the screen, and it will lead you to a link that you can register your attendance to confirm your attendance today. So see you back after the break. Thank you all. Welcome back, everyone. Our final speaker for today is Mr. Yusuf Al-Anazi. Mr. Yusuf Al-Anazi is a health informatics consultant specialized in clinical and healthcare systems, holding a master's degree in health informatics, first honor from King Saud University for health science, and has more than 10 years experience in the medical field. He's a founder of eHealth's SA website, the first Arabic website of eHealth in the world. Mr. Yusuf is working currently at Lean Business Solution Company in business development of digital health section. It is my great pleasure to welcome you, Mr. Yusuf.
Thank you all. I think now you can hear me well, isn't it?
Yes, yes, we can.
So in the beginning, I would like to thank the organizing committee and Saudi, our second health cluster in the Central Region, as well Imam Abdurrahman bin Faisal University, and I will not forget TibX, which is a fantastic project in Imam University, Imam Abdurrahman bin Faisal University. In general, today will not be a long lecture as my previous fantastic speakers, which has rich clinical information and kind of tweaks and experience. Today we will have, or our lecture will discuss a crucial things that all dentists and practitioner need to know. Today we will know about dental informatics, EMR, data integrity, opportunities, and the future national project which is going on these days. First of all, we will have a question now. So, do you know health informatics? We'll take 1 minute to get the answers. Okay, great. So till now, more than 65 of 2,397 audience knows what does health informatics mean. Good. But you know now what does health informatics mean, but do you know what does dental informatics mean? The dental informatics is a specialization within health informatics. So it is a drive of health informatics. Health informatics in general, as you know, it is a multidisciplinary field that seeks to improve healthcare through the application of health information technology. So it is merged between a technology and a clinical expertise. As well, it's focus on health science and healthcare delivery, how to deliver the healthcare information well, how to manage the patient file electronically, not like before as a paper paste. By the way, there is an association, they call it American Dental Association. That association is leading for advocate of oral health, and they have a subgroup, they call it dental informatics group. And if you interested in informatics, especially in dental, while you graduated from university or you want to complete your master degree in that, I'm not sure, but Jامعة الامام الرحمن bin Fayصل, they have program for female, I think, in health informatics. As well, King Saud bin Abdulaziz University in Al Hassa and Riyadh, they have as well a college there. They are giving a bachelor and master degree in that matter. So we will go to the other question. If you know the health informatics, do you know what does HIS mean, or what is HIS? Usually when you go to any clinic, any hospital, you will listen about, do you have HIS or you don't have HIS? Is there a system? Is there how you deal with your patients? Are you using paper, file, or HIS? So what is HIS? Okay. So I will give less than a minute and then we will end the poll or the question. So about 45% they know what is HIS, while more than 51% they don't know. So we are talking about the HIS. HIS is a health information system, are frequently referring to the interaction between people, process, and technology to support operations management and delivering essential information in order to improve the quality of healthcare services. So it's not only technology and it's not only process as well, it's not only people. It's a cooperative between all of them. So if you want to have a very excellent HIS, you need to care about the people who run this HIS as users, the people who implement this HIS as specialized, and the process that you have in your clinic or your hospital that you need to automate it to be implemented in that technology and to serve your patient. So always when they bring the HIS in your mind, just remind that it consists of people, process, and technology. It's not only technology, and it's not only process as well, it's not only a people. So who is the people? When we are talking about people, is it a patient or dentist, hygienist, nurses, receptionist, insurance guy, or even the housekeeper? The people, or we call them the champions of the system. Those are the SMEs. What do you mean by SMEs? SMEs means the subject matter expert in their specialty. So if we have a dentist, we have a GP dentist, and we have a consultant, root specialized, cosmetic, etc. So all of these people, or all of those people, you need to involve them while you are choosing your HIS or your system. Involving them by major three things and the vision and mission. Why do we need to have an HIS in this hospital or this clinic? So it has to have a vision for that. We need such as we need the HIS to automate all the process in the hospital or in the clinic to be ready for any integration with the government, with insurance company, as well to standardize all the process that we have. So no one will just write any report with multi vocabularies, which is not referring to a unified statement. Needs. Sometimes you will get an HIS, but it is not covering your needs. It's only a billing system, like what we have now in all the dental clinics. They have a billing system, and beside it, X-ray machine, as well a paper file. So you need to know what is your needs before getting an HIS. Great. So now we will go to the process. If you will say, Yusuf, you told us it is a process, people and technology. We know the people now. Okay, what about the process? What do you mean by process? A process is a business process and workflows that aim to your goal. So you need to, the first, knowing the patient journey. Is the patient journey start from home? What do I mean by home? That the patient will call or go to the application or the website of the hospital or a clinic and pick appointment? Is it starting from that area, or it will start when the patient had an inflammation or implementation, and then he will go to the ER, then he will come to your clinic, etc. So you need to know what is the patient journey. It will start from this part and it will end in that part. The current workflow, your own current workflow of the clinic. Don't go and gather any other workflow from other clinics. Your own clinic. What is the workflow of that clinic? In the end, you need to simplify the process. Do not put many process for nothing or has no aim for that. What I mean, nowadays, they ask all patients or visitors to the clinic to get a blood temperature, body temperature before going there. It is a new process that it has to be there. But unfortunately, they are still using a paper on that. So in your system or in your HIS or the HIS that you are conducting, you need to ask them, please put the form of body temperature before entering the clinic. Okay, the abracadabra, as many physicians and other people who is not or who is non-technology people, they are saying it is the magic, the technology doing everything. I can bring a technology which just the patient need to take a picture for his teeth, and then the technology tell me that he has A, B, C, D, and he wants to, we need to do blah, 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 blah. It's great, it's right, but not this time. What do you mean by technology? The technology that can help you, not the technology that make your life difficult. What do you mean by that? We need to have an updated solution. So what does updated solution mean? When you go to buy any technology or any HIS, make sure that you buy something new, not a legacy system. بمعنى آخر لا تأخذ سيستم بسي من حراج الكمبيوتر، يكون قديم جدا وغير صالح للاستعمال الحالي والأنظمة حقته تكون جدا قديمة. فتry to take an updated solution. As well, a scalable solution. What do I mean by scalable solution? The solution can go further with you. Nowadays, you are starting as a clinic, but after maybe 1 year, 2 years, you want to establish a lab, you want to establish pediatric clinic, adult clinic, cosmetic, blah, blah, blah. So you need to have an scalable HIS or a scalable system. Medical devices in dentology or in dentist clinic, usually they are using CT, X-ray, panorama, etc. So you need to have a system which can be integrated with this kind of medical devices. Usually the medical devices, it has to support DICOM for, the HIS, it has to support DICOM. DICOM, it's referring to images. We will come to it at the end of this presentation. Now we will go to something more practical, that how we can choose HIS. I remember one of my friend, he just called me after he get graduated as a GP dentist, and they were rich family, and his father just gave him money and asked him to build a clinic. At that time, he called me and said, Yusuf, I need to have HIS. I told him it will cost you this number. and it's covering everything. He said, no, this is costly, and I think I will not go for that. After 2 months, then he called me again. He said, Yusuf, save me. I made a mistake. I got a HIS from Haraj Computer. Then after 1 month, there was many problems in insurance claims as well. We have a lot of messy data, etc. So for you as a dentist or specialized and or investor, you need to know how to choose an HIS. But in the beginning, we need to know that HIS should help you to solve your problems. I mean, in the clinic, simplify your work and support your decisions, not making your life difficult, as my friend did. So first of all, you need to have an HIS which satisfy your needs, your budget, your strategy and vision. Then to get an HIS which has a high rate in a class evaluation. There is a website, they call it Class. That website is free of charge. You can just log in there and you will see all the rate of the HISs in the world, as well achievements. The HISs is look like, if we can compare it with the hotel. Now, when you go to booking to choose a hotel, you will have a rating for these kind of hotels. Some of them getting 5-star, 4-star, etc. But this kind of stars, it's referring to achievements in that hotel or services that hotel has. Same things in HISs. So there is something they call certificate, they call it HIM stage 7 or HIM stage 6. So make sure that system that you will buy it has gained this certificate in some areas of a clinic. At the end, you need to have a site visit. Go and check any excellent clinic in locally or international. What they are doing, what is their system, what do they have, how they work on it. Ask them all the questions that you need. Then buy the system. Do not just take any system because it has billing module and electronic file. This is not the HIS. This is kind of ERPs. As we said, review before buy. You know to know how is the stability of the system, size. Is it clinic? Is it a complex of clinics, hospitals, medical cities, specialized centers, and the price. Make sure the price is reliable price, not high price or lower price. As we can see here, this is 2 websites, Software Advice and Captura. Those websites are rating many dental information systems. Just go there and type dental system or EMR, it will come to you. Also, this is the 2 websites of Class and HIMS Analytics. Both of them has the names and the names of organizations and the names of the system itself. You can find them there. Before buying, as I said, you just need to check and then go. Now we will go to something more relevant, which is data integrity. Before going to that, I will tell you a small story. 3 years ago, I was looking for a very good dentist to make my smile better. I went for the highest or the most expensive clinic in Riyadh. And when I went there, you know, the doctor was just diagnosing my teeth, and I was looking to the system that they have. It was an old system, legacy system, while it is an expensive clinic. Therefore, I asked the consultant there, and he's a famous one. Maybe all of you know him. I told him that Mubarak, why you are using this old system? He told me, I don't care. I can see your teeth, and I can diagnose you, and after that, everything will be saved here. But the main thing that I rely on it is your X-ray. Other things, it's not simplified. I cannot write everything. It will take a long time, and they need to finish many patients. So what does that mean? If he's just rely on my X-ray, that means there is many of my data or of my case data is missing. So if we want to define the data we need it to be integrable, that can be integrated with any kind of systems. In general, in computing, data is information that has been translated into form that is efficient or movement or process. You know, the standard of or the lifestyle of data. It's starting with data, which is raw, then it will go for information, for knowledge, and then to the wisdom. But before that, in medical side or in medical sector, the data is started from the MRN or medical record number, which has to be unified. The data or kind of data, other kind of data is the medical images, CT, MRI, nuclear, and X-rays, and the diagnosis and the treatment plan. All of them are data. So what does the data integrity? The data integrity means the accuracy and consistency of stored data indicated by an absence of any alteration in data between two updates of a data record. So what does that mean? That means that data is written by standard rules and procedures as well. It has error checking, or that system, it has error checking to make sure that there is no any artifact in that data. Validation routines, verifying the data. When you put the patient number or when you put the ID number of the patient, let's say 10234567, when you just click enter, all the information, it will come to you from the NIC. NIC is National Information Center. So the patient data will be correct, his first name, second name, last name, and English, Arabic, as well as date of birth, etc. So data integrity, they are based on a standard. They call it HL7 or FHIR. What do I mean by standard? Or what do I mean by FHIR? You know, medical terminology, they are using it to standardize the terminology in medical, not like in English or Arabic or French, etc. So in technology or in health information technology, they are using something they call it HL7 or standard HL7, which is health level 7 international standard. HL7 is a non-profit ANSI accredited standard developing organization dedicated to providing a comprehensive framework and related standard. These kind of standard, it will help in HIE, health information exchange. So the patient will get all his information from all hospitals and clinic in Saudi. Integration between systems. So if XHIS needs to be replaced by YHIS, and both of them are using HL7 standard, it will not take long time to be integrated and to be replaced. And of course, it will support clinical practice to delivery and evaluation for healthcare services. We'll go also to the DICOM. Should or must all of you as a dentist know what does DICOM mean. DICOM is digital imaging and communication in medicine, is the international standard to transmit, store, retrieve, print, process, and display medical imaging information. You know, the X-rays machines has images. Those images standard by DICOM, not GPG or BNG or GIF or BSD, etc. of the tags images. It's based on the DICOM. So when you want to buy any X-ray machine, make sure that this X-ray machine has a system supporting DICOM, so you can interfere with that machine and HIS. The DICOM is supporting the interoperability and evolving, as well the integration between the workstations and HISs. Why do we need to have this kind of integration or data integrity? Because we are going to NAFIS, or Unified EHR. NAFIS is a national platform for health information exchange, which has a two-part. One is for clinical and the other is for insurance or billing. If your clinic or your hospital does not have the HIS, which support all the integration method and procedures, as well supporting the DICOM, HL7, etc., you will not be able to be integrated with NAFIS, which means that you will not be accredited by any insurance company in that era. NAFIS started 1 year ago, and I think it will be completed in 2030. So all of the dental clinic has to have professional HIS updated and has all the criteria that we have explained before. Why do we need the data to be great and to be, as we said, standard? Because you know this programs that needs data, information, knowledge, and then wisdom, because we are going in this kind of days for big data, AI, our next oil, and prediction. So make sure that all your clinic has a very good HIS, as we said, to get this kind of wisdom and knowledge later. At the end, as founder of eHealth SA, I encourage all of you to visit صحة إلكترونية. راح تلقون فيها أكثر من 60 خبر حصري وعام في الصحة الإلكترونية ينشر أسبوعيا، بالإضافة إلى لقاءات حصرية متخصصة في الصحة الإلكترونية ومقالات ومراجعات عن أنظمة متخصصة في الصحة الإلكترونية والHIS. أشكر الجميع، وتقدرون تتواصلون معي على الإيميل أو حسابي في تويتر أو حتى عبر الصحة الإلكترونية. يعطيكم ألف عافية، صراحة استمتعت جدا في المؤتمر خلال الأيام السابقة، وأتمنى إن شاء الله أني قدمت شيء بسيط يفيدكم في عملكم، وتابعوا ما تفعلون من أشياء جميلة. يعطيكم العافية.
يعطيك العافية Mr. Yusuf. Thank you very much for your very informative presentation. I looked for the question, but nobody asked any question related to this topic. So on behalf of the organizing committee, I want to thank you, Mr. Yusuf, for your valuable contribution. So at the end, at the end of the symposium, I'm so grateful for the joint efforts of all the distinguished speakers, all members in the Deanship of e-learning and distant e-learning and distant learning in Imam Abdul-Rahman bin Faysul University, those in TEDx and the organizing committee of the symposium, and for all attendees. As with your participation, the symposium successfully finished all its sessions. Thank you all, and hope to see you in other symposium later on. See you then.